Bismillahirrahmanirrahim. This video is about evidence-based medicine and medical informatics. Basically, from today onward, we are going to start the EBM book of obstetric and gynecology, and this is the first page of EBM book. You can see from here. It's basically page number 3 because in the first 2 pages just the introduction is written. So the first thing is about, in the first chapter, introduction. The first question is that how the term EBM came into existence. Okay, so it's written in the book that traditionally medical practice was based on pathophysiological mechanisms of the disease and experience of authoritative experts. Okay, the term evidence-based medicine (EBM) was first coined by Jordan Guide around 1990 to describe the process of bringing critical appraisal of research evidence to the bedside and basing clinical decisions on the clinical research evidence, clinical expertise, and patient values. The title was intentionally provocative. Okay, the second thing is about the importance of randomized control trial. Okay, now developing in parallel with EBM, there was recognition that randomized control trial are the best way of establishing the effectiveness of the treatment, and recognition that whilst a single study is useful, pooling the finding from all studies provides the best evidence. So that is basically the importance of randomized control trial. Okay, so we do pooling of all findings in the randomized control trial. That is what written in the introductory part. Okay, another thing is about the effective care in pregnancy and childbirth. Effective care in pregnancy and childbirth was the first attempt in medicine to look thoroughly for research evidence and systematically summarize the effect of treatments in clinical area. This led on to setting up in 1993 of Cochrane collaboration and international network to prepare, maintain, and disseminate systemic review. So that is about effective care in pregnancy and childbirth. Now another question is that has EBM evolved? Has there been any evolution in the EBM? Yes, EBM has evolved, and there is now greater emphasis on the evidence in the context of the patient values and preferences. Critical appraisal of the body of the evidence takes time, and it is inefficient use of resources to search the literature for every treatment of every patient, and increasingly, therefore, processed research such as systemic ways, summary and digest of the review and evidence-based clinical guideline can offer the highest level of evidence on which base the decision. Okay, another thing is that how EBM can be abused or used and abused. Okay, testing, treatment, and website bad science provide an accessible introduction to the use and abuse of evidence. Okay, so this website can be abused. We have to remember that. What are the steps of practicing EBM? Now, the practice of EBM comprises 5 steps. Okay, 5 steps are important. These steps are also used by the guideline developer to develop evidence-based clinical guidelines. Now, what are those 5 steps? The first is that defining clinical questions. Clinical questions should be kept in mind. Okay, and so there should be a clinical question. Second thing is that finding the best evidence. Okay, we should find the best evidence after clinical question. These are the first 2 steps which are very important. The third step is that appraising the evidence for its validity, that is closeness to the truth, impact, that is size of effect, and applicability, usefulness in the clinical practice. So basically, appraising the evidence for its validity needs to be remembered. What is the fourth step? Integrating the findings of critical appraisal with a clinical expertise and patient values. So, integrating the finding. And the last one is that reviewing or auditing the clinical practice and the efficiency of the above steps. Okay, so that is what written in the introduction part of the first chapter. One important point which we left in this whole introduction is in the part when we were discussing has EBM evolved. The last line was that nevertheless it remains important that clinicians can appreciate the principle of EBM so that they can distinguish